Hey everyone, I'm Dr. Amir, a medical doctor from Orange County, California, specializing in the art of aesthetic medicine. And today we're going to dive into the fascinating world of microneedling. This treatment has transformed the way we approach skincare. I'm thrilled to share how it works and why it might be the perfect fit for you or someone that you know. So microneedling, as the name suggests, uses a multitude of tiny needles to penetrate the skin. The operator adjusts the depth of the penetration, allowing for both deep and superficial treatment depending on what we're trying to do. These tiny needles create microchannels in the skin, which are fantastic for delivering active ingredients applied topically to your skin. So whether you're addressing hyperpigmentations, or using a powerful antioxidant topically, or performing a vampire facial, or with PRP, or with growth factors from your own blood, these microchannels help those ingredients to penetrate deeper into the skin for a much more robust final results. Beyond enhancing ingredient delivery, the microneedling process itself triggers a wound healing response, so stimulating collagen production and increasing blood flow by creating tiny new blood vessels around the area of treatment. These responses induce the secretion and production of your natural growth factors, leading to improved collagen and better absorption of the topical ingredients, including your own skincare line that you use at nighttime. So microneedling is also a powerful tool for reorganization of scar tissue. So scars are essentially like disorganized collagen. By causing small traumas to the scar tissue, microneedling stimulates the healthy collagen synthesis and reorganization, and helping to minimize the appearance of the scar tissue. This technique is also effective on stretch marks, promoting the production of healthy collagen and more organized extracellular matrix, especially when the stretch marks are still fresh. When the stretch marks are a little bit aged, they become much harder to treat. So when it comes to microneedling instruments, I recommend using a professional microneedling pen at a medical spa over these microneedling rollers that a lot of people use at home. The pen creates precise channels by going straight in and out of the skin, ideal for applying topical active ingredients and initiating that wound healing response. Okay, so now let's move on to Microneedling Radiofrequency, or RF microneedling. So this is like our device, the Pixel 8, or other devices out there like the Morpheus 8, Vivace, Potenza, which combine microneedling with the radiofrequency energy. This technique heats the skin beneath the surface, sparing the epidermis while targeting deeper layers to stimulate a wound healing response. And it can melt the subcutaneous fat depending if you're planning on doing that. I know there's a lot of Reddits and subreddits and videos that say if you use microneedling, you can melt all the fat. You can do this if you want to. I mean, if you're using it incorrectly, that can be a side effect, but some people do want to melt the fat underneath their skin. And depending on the settings, depending on the depth that we use, that can be a result that we can get. But if we're only targeting the skin, the subcutaneous fat is spared and it's not affected by the treatment. But since we're on the topic, let's finally talk about the resurfacing lasers, which offer a precise, controlled method of treating the skin. So lasers like CO2, the fractionated erbium, the ablative erbium can penetrate deeply to treat both the epidermis and the dermis, inducing a wound healing response and stimulating collagen and elastin production. Depending on your skin needs, treatments can range from a monthly session like a CO2 laser facial or a fractionated erbium to a yearly maintenance, which is your full ablative CO2s, which can even be pushed a little bit further out to like maybe 1.5 to 2 years.